afternoon. My name is Fumi Ogunyoye. I'm a podiatrist and I am here to give you a foot examination, a basic foot examination that we would do if you were having a look at a diabetic patient. I understand that the audience here is both professionals as well as individuals themselves. So I will try my very best to address both. And obviously feel free to ask us questions at the end to clarify any points that may not be clear. So when we start with a diabetic foot assessment, what we usually look to is try to observe the patient as they are coming in to sit down in the chair. So at this point, if there's an uneven gait of some sort, they're walking in a particular way, as a podiatrist or someone that's specializing in looking at people's feet, you will usually know if there's something odd about the way they may be walking. So sometimes that can be an initial thing to sort of use to break the ice, or they ask, oh, by the way, is there any reason why you're walking in this manner? Because sometimes that could be an indication possibly of something that may be happening, in the feet. Sometimes it may not be, but it's always good to check. They take off their shoes. So that's the first point. You see what the shoes are like, because sometimes when people have problems with the feet, the problems can stem from the footwear. In fact, a lot of problems do stem from footwear when it comes to problems with pressure points on tops of toes. So footwear is very important. So you look into the shoe, examine inside the shoe by just having a feel through to ensure that there's nothing you can feel there that shouldn't be there. We have had instances of nails in shoes going from one end to the other that could cause problems. On instances where shoes are worn so badly, so we need to give appropriate advice for them to maybe change the footwear. So the key thing is have a look at the shoe inside and outside. Have a look at the shoe fitting. Is the shoe fitting adequate for the shoe, for the foot shape that is before you? Because sometimes people do wear inappropriate footwear. So it's always good to give a little bit of advice. Obviously, depending on the, climate where people are, you may find that some people, if you're in a warmer climate, may want to wear shoes that are open toe shoes. Again, with open toe shoes, what we tend to advise is to avoid wearing open toe shoes because of the risk of trauma to the toes, because the toes will not be protected. So that's just something to mention. Open toe shoes, as we can see, this is another example of a footwear that's not the most appropriate type of footwear. Open toe shoes are not great. So this is another pair of shoes. These are not great because they don't give support, adequate support, to the feet. So we usually advise people not to wear inappropriate shoes, if it can be helped. And especially if they're getting lesions and if they're getting corns, if their feet are at risk, we always advise them to wear the right sort of shoes. Another example of footwear are trainers, which are really good, very versatile, excellent, because they tend to have, all the right properties for good fitting footwear. So if people can get trainers, or if people can get, lace-up shoes that are pretty good. Another example of lace-up shoe here. So you really and truly what we want is a shoe that follows the shape of your foot, deep enough and broad enough. That's really the key thing. And ideally covered at the front and covered at the heels as well. So moving on, they sit down, we look at their feet. So one of the things I will suggest is temperature. So have a feel of the legs, have a feel of the foot, have a feel of the toes. Is there a temperature change? Is there anything marked that will sort of draw your attention to thinking, is there something here? Another thing we do is a capillary refill test. So we hold on to the toes, blanch them, let go. Usually we get a capillary refill time of about 2 seconds. So that's another test to do. Look at the feet for any deformities. So just observing the feet, you may find some people may have a bunion, some people may have a hammer toe, some people may have a stiff toe, osteoarthritic toe, where there's not very much movement. Some people may have other sorts of deformities. There's so many, deformities people may have. They may have a Taylor's bunion where you get a bowing of this area. They may have, you know, hard skin. They may have corns. They may have breakages around the heel. They may have blisters. So it's always good when we examine the feet to have a feel around by feeling the heels on both feet, checking underneath carefully, and then very importantly is to look in between the toes. So we look in between each and every toe, make sure that we capture if there's any form of maybe maceration where you get dampness, if there are any ulcers, if there are any corns, if there's any hard skin. Sometimes you do get problems in between the toes, and that's one of the areas that can get forgotten. So please don't forget to look in between the toes. Excuse me. And then what we also ask you to do is when you feel the heels, is to check that the heels are not cracked. If they are cracked, remember to give the appropriate advice about how to care for cracked heels. And also check to see if the feet are well hydrated, to see what the quality of the skin is like. Is the skin excessively dry? Do we need to maybe give people advice as to creaming their feet if they're not doing it? And also, you know, check if they have any warts, calluses, as I mentioned earlier, corns, ulcers. Sometimes you may find that, you know, some ulcers sometimes hide on the hard skin, especially if maybe someone has problems with sensation. So what we sometimes find is after taking hard skin off, in some cases you may find the odd ulcer here or there. Sometimes you may even find, if it's a patient that, you know, is looking at their feet very carefully, sometimes they will actually spot it themselves and say, oh, there's something here, you know, there's an ulcer, there's a wound that won't heal, or there's something leaking. So, you know, those can be indications as to something not being right. Next thing to do, obviously, is to also check the toenails, see what the toenails are like. Sometimes you may get an ingrown toenail. Sometimes you might get, you know, thickened toenails, fungal toenails. If you get an ingrown toenail that's pierced the skin, that could be another thing to watch out for, because that could be a point of entry, you know, that could cause and lead to some sort of ulceration. So that's something to check out for. And then the other thing to do when we do the examination of the feet is we also check the sensation. So with that, we use a monofilament and we check particular points on the foot by asking the patient if they can feel the light touch. And we ask each time, can you feel? Tell me if you feel me touching. Thank you. And we ask, can you feel touching? Can you feel touching? So they will tell us when they feel touching and if they do feel sensation. If they don't feel sensation, this is obviously where there may be issues with neuropathy. And if this is the case, it's always good to document it so that the progress and the pattern can be followed over time. And also appropriate foot care and footwear advice can also be given, you know, with this knowledge. Next thing to do is we also check the pulses. So what we do is we check the dorsalis pedis pulses, which are up here. I can feel them. Yep, they're strong and palpable. And I'm just going to feel the posterior tibialis pulses just here. Yes, I can feel those as well. Now I will use very quickly my Doppler just to confirm what I can feel. And I hope you can hear the sounds of the Doppler. My colleague giving the next presentation will give a bit more detail, signposting about the Doppler when she gives her vascular talk. So I'm just having a feel for the dorsalis pedis pulse here. Can you hear that? Right, let's see, it's gone. Can you hear that? Okay, and I'm going to look for the posterior tibialis just here. Sometimes it hides just behind the malleoli. I'm just going to, there we go. Okay, I hope you heard it there. I just cut it there. So this is the posterior tibialis pulse. Excellent. So just to recap, when we do diabetic foot examination, we check for temperature, we observe the foot, we check for deformities, we look in between the toes, we check for the quality of the skin, see if there's any breakages, see if there's any hard skin, any corns, any ulceration. We look at the nails, we check the quality. We do the sensation, we see what their feeling is like. And we also, check the pulses. We look at their shoes. And then we also have a conversation at the same time with the patient. We then obviously need to check with the patient. Although we are doing the feet, it's always good to think of the patient as a whole. So we ask the patient, are you having your eyes checked? How is your diabetes management? Who is checking this up with you? Just to ensure that they're being signposted and they have appropriate advice and help, because obviously the eyes are very important when it comes to diabetes, and the recommendation is usually for them to have an annual eye test. So it's always good to check that they're having these things done and they are aware of it, because sometimes we ask people to check their feet and to do all this with their feet, but if they can't actually see what's going on, then that sort of defeats the purpose. So I hope that this has assisted today. Any questions, we are very happy to help as a panel. So please let us know, if you've got any questions for us. Thank you very much. Thank you.